Hello, welcome everybody. Thanks for joining us today. We are really happy and privileged to have Astro Health with us today. You're going to discover uh, what I hope you expect to discover today, but it's very, very interesting tech in healthcare. And uh, Shraddha Dr. Chaugule, sorry, has done an amazing job validating her thesis, and they're at the point now where they're seeking capital to further their progress in this effort. And so I think you're going to find it super interesting. We can't hear or see you, but we know you're there. Well, in saying that, I mean that you can ask questions in the chat, the Q&A. You just can't ask them outright. And so we encourage you to do that. We have a lot of people coming on today, and please ask your questions as they come to mind in the chat or the Q&A. And we're going to record this. And so if there are others that you know that might find this interesting, you're certainly welcome to share it with them, and we'll make sure you get connected directly so you can have direct conversations for sure. So with that, thank you for joining us. Once again, the Family Office Insights community is really robust and steps up regularly. We really appreciate that and love having you as members. Thank you. So please take it away. Thank you for being here.
Thank you. Thanks, Arthur, for the warm introductions and for having me here today. I really appreciate it. And hello, everybody. Thank you for joining us today. Today, I would like to introduce our company, Astro Health. And to begin with, I'm Dr. Shraddha Chaugule. I am the founder and chief outcome scientist at Astro Health. I'm a pharmacist. I also have a PhD in health economics. And I have worked with the CDC, Children's Hospital Los Angeles, and RAND for research work that has resulted in publications. And in the corporate world, I have worked as a head economist for a digital health company, and I have been very successful in getting market access for the device, digital health device, in countries like Canada, Australia, parts of Europe, and also within insurance companies and Medicaid in the US. At Astro Health, we are focused on solving the most important problems facing health systems today. So when I wanted to start this company, there was a lot of media coverage around substance use disorder. And as an outcome scientist, when I looked into the problem, I realized that around 40 million people in the US suffer from substance use disorder, but only 2.7 million people seek treatment. And so there is an aspect of initial taboo and inertia in getting treatment, but also there's a problem with access to treatment because 82% of the prescribers are in urban areas. So there are hardly any prescribers for substance use disorder, which are DEA licensed in the US, in rural areas. And one third of the people are on Medicaid in the US. And as we know, rural hospitals are closing. But even before that, it takes about 35 miles on average to get to the hospital for these patients. So there is an unmet need for digital health treatment delivery systems to provide access to treatment. But even before we go there, of the patients who seek treatment, one third discontinue treatment, leading to relapse related hospitalizations, ER visits, and discontinuation is a very big problem. So, here at Astro Health, we decided to solve this problem. And we designed the world's first multi-agentic digital health AI platform for real-time patient monitoring, real-time patient feedback, and support in real time. And this would help reduce hospitalizations, ER visits, and improve treatment adherence in patients. So what we did over last year is that we worked on a data set with 4,000 individuals, and this data set had information on physiological biomarkers like sleep and physical activity, how much time they spent on yoga, meditation, their mental health care utilization, their clinical assessments for depression, anxiety, alcohol misuse, substance use. And along with that, their other markers such as their race, ethnicity, and what we were able to achieve is 90% accuracy in detection of onset of mental health conditions in these people. And we were able to validate our systems, neural network using real world evidence data, and present it at American Psychiatric Association conference in May of this year. And our data architecture we are presenting in December this year at an IEEE conference. And for the next phase, because we were able to demonstrate and validate our system's accuracy, we have a pilot program at USC's health system in Los Angeles with Los Angeles General Medical Center. And we have an IRB approval right now, tentative, and we are raising money right now for the real world validation so that we can generate clinical outcomes. And these are necessary to get insurance coverage in the US. And it is about a 3-month study, and we expect to start generating revenue in 6 months. And then the second problem we are really focused on solving is the problem of longevity and caregiver burden. And this is a problem that most of us, if not all, face in their families. Like my grandfather had Alzheimer's, and he, towards the end of his life, he couldn't take care of himself. And my uncle was a full-time caregiver for him. He couldn't bathe by himself. He couldn't walk properly. And this really impacted me as a person. And I looked at what was happening right now in the market. How people detect Alzheimer's or dementia, and what are the things that they do to support these people. And right now, they are just using paper-based tests and visual aids to detect neurodegeneration. So we aim to help these patients extend their independence and improve quality of life using AI, and have a 360-degree ecosystem to support them and help reduce falls in these patients and reduce caregivers' burden. So we are raising, again, for a second clinical study for real-world validation using Alzheimer's patients in the clinical study for our platform validation.
On the first group of people, the 4,000,
Mhm.
I'm just curious, the environment in which you were able to access, was it their home? Was it a, a substance abuse center? What type of, or is it a combination of everything?
Yeah. So it was a study done with 50 states in the US, and the sample population was 20,000 individuals. But we had complete data on only 4,000 individuals, and that data included data on depression, anxiety, substance use, and alcohol misuse, and all of the other physiological biomarkers. And my assessment is that they probably put in millions of dollars in getting this survey data from people. And yeah, I think now there have been cuts to the government, to stop this kind of data collection. But I was one of the researchers who's able to,
I see.
like,
So you
yeah,
already had the data, which was super
yeah,
beneficial, right? Yeah.
yeah, yeah.
Got it. Yeah. Great. Continue. Thank you.
Yep, and this is our solution, multi-agentic AI digital health platform for health systems and payers for substance use disorder. We would have AI agents for real-time patient feedback. And what it really does is removes the first layer administrative burden from the system, and reduces burden on nursing staff and health advocates and doctors. And then we have deep neural networks to continuously assess stressors in patients using their physiological biomarkers, clinical assessments, clinical biomarkers, and also conversational data to detect in real time the risk of relapse and support these people in real time. And then we have a partnership with Indiana University's Dr. Christina Lerman to develop an LLM framework for real time detection of harmful behavior and suicidal ideation. And what this would do is that the remote patient monitoring would help improve treatment adherence and clinical outcomes. and then also achieve cost savings for health systems with decreased hospitalizations, ER visits. So this is a very good ecosystem for the patients. And how we are able to achieve this? It's with our breakthrough contextual AI engineering with pending patent application. So right now, current variables, they only assess footsteps or sleep patterns, or we have clinical assessments that tell you if a person is clinically depressed using PHQ or GAD-7 for anxiety or DSM for substance use. But they do not help identify what is causing the mental health condition or the substance use onset. And what we are able to do is look at the context surrounding a person using environmental and personal stressors, the clinical biomarkers, their historical EHR data, and also their chatbot conversations. And we are able to integrate all this data using a very novel contextual AI engineering with weighted neural networks where we are able to pinpoint exactly the root cause of the onset and then provide support to these people in real time to address those stressors using generative AI. And that is one of our AI agents. And what is unique about this is that it would have human in loop, which would be psychiatrists and health advocates. So the AI is always supervised and it's safer, it's ethical, and it's more as a assistance to the psychiatrist and the physician in the system.
I'm sorry, I was just saying a real person, not just the AI, right?
Yep,
Yeah.
correct.
What's PHP? You mentioned PHP earlier.
Oh, it's PHQ.
PHQ.
Yeah, that's a clinical assessment. It's validated and it's a paper-based test. And it's also a digital kind of questionnaire, which is used by clinicians to assess depression. So if the score is above a certain level, then you know that the person is clinically depressed, and that is how they identify clinical depression in practice. Yeah.
Got it. Thank you.
Yep. And again, how this works, it's multimodal data capture, real-time processing of data and support, root cause detection, and then adaptive support because the system evolves with the patient and supports the patient in real time. And then we expand into longevity in another 2 or 3 years with our, 510K approval for our neurodegeneration assessment platform. And so, yeah, and then we have AI agents to help with care and remove administrative burden from the system. We do have clinical and engineering validation, and we have a patent application pending. So that is what separates us from all of the other companies because we have validation from American Psychiatric Association. So we are backed by clinicians and the clinical community. And then for our data architecture and engineering, we have validation from IEEE, and we'll be presenting the results at Top 3 Artificial Intelligence Conference on December 20. This December 20, actually, yeah. And then this is how our model validation results look like. We have 90% accuracy for our system using real world evidence data. So we have shown the proof of concept with real world data, but you have to understand it's one time and point. And so now we want to do a real world study with humans. So we will have real time data and prove that in real time, we are able to moderate and help people and support them so that they don't progress towards depression and substance use, and in fact prevent their relapses in them basically. And this is the premier health system in California that we are doing our pilot program with, and Hospital Los Angeles, Keck Hospital of USC, and Norris Cancer Center are also part of USC Health System. So once we complete our pilot program with Los Angeles General Medical Center, we plan to integrate our system with the other hospitals as well. And the investment highlights, we have clinical and technical engineering validation. We have early clinical traction with pilot programs at USC Health System. We are in talks with HCA Healthcare. They're the biggest network of hospital chain in the US with around 186 hospitals. We have compelling economics because we know that this is going to reduce hospitalizations, improve adherence, and we are expecting a 33% reduction healthcare costs per employee. We have massive market opportunity. Our TAM is $800 billion for workplace stress and substance use. And the SOM that we are targeting is very niche. It's $3.55 billion for employer covered health insurance. We have proprietary advantage with our patent application pending. And we have a world class team. It's me and then our co-founder and CTO Ian Thornhill. He's our founding engineer. He has deep expertise in developing and deploying AI application. He does all this spatial mapping himself, which actually companies like ARM do. And he also builds variables. So we have all the talent in-house, and we are now raising money for additional hiring along with our clinical programs. And then we have clinical advisor in Dr. Eric Shi. He is the head of the residency program at Keck School of Medicine at USC. And our AI advisor is Dr. Christina Lerman. She's an expert in multi-agentic systems. Again, I
What's
mentioned.
can you talk a little bit about what the pilot will look like?
Yes. So we would have 144 physician residents. So, so one of the problems, as you look at here, the TAM, we have substance use disorder as $500 billion. And we know that stress is a significant precursor for substance use. And 85% of the people are employees are stressed out. So our pilot program is with the physicians at Los Angeles General Medical Center. It's with 144 naval resident physicians. And what we are trying to show here, and we will be 100% successful in this because we have proof of concept, is that we would be able to prevent burnout, stress, depression, anxiety, and substance use in this population using our system. And we would be able to take these outcomes and go to DoD, go to VA, go to Medicaid, go to health systems for insurance coverage via benefits, as well as going to major insurers like United Health. And so we will be giving them variables, and along with that, they would have a mobile application and web application where they will have a dashboard and they will know their stress levels every single day and how much time they slept, how much time they did physical activity, what was their patient workload, how many hours did they work, and what were the exact stressors or what was causing their depression and anxiety. And then the system will also support them in real time and give them interventions to address those stressors. And we would know in 15 days if those interventions worked or not. And the system will modify and adjust the interventions. And then they would also have human in loop. For example, they will work with Dr. Eric Shi and health advocates. They would check in regularly with them. So yeah, we are very excited about the pilot program. These are top of the notch, physicians. So we would have the data that we need for access to enterprises, to health systems, for patients, for physicians, for employees. And then because these are naval resident physicians, we can also take it to the DoD for market access.
So
So
it's super smart having the doctors be your
yeah,
test case because
yeah,
it's a target-rich environment, right?
correct.
They're stressed out.
Yeah,
They're working with life and death sometimes,
yeah,
and they also have access to drugs, right?
correct,
So super interesting.
correct.
Is it a paid pilot or is it proof of concept pilot?
Um, it's not a paid pilot. It's because this is an outcome study. So usually people have clinical trials, right? So like a phase three clinical trial. So it is like a phase three clinical trial for us, and it is a clinical study because it's not an intervention before and after. We want to take this platform and integrate it with the health system and show that we were able to reduce burnout, stress levels, and prevent substance use and alcohol misuse. Yep.
Yeah, totally makes sense. Yeah, coming out of that study, I don't know the process, but it sounds to me like that will validate you to get
Yeah.
insurance reimbursement and so on
Yep,
and so forth, right?
correct. That's
Yeah.
absolutely correct. And there, our model is B2B model. And then for the enterprise stress management platform, it's going to be subscription-based pricing. And when I looked at the competitors, I wanted to like price it really cheap so that it is like a Jarvis for every person or every employee. So it's about $13 for tier one. And tier two, we will include a health advocate or a therapist into the system, and that would be around $21 per month, and very low pricing. The first year one would go through HR leaders, the second one would go through benefits in under HR, and then B2B substance use disorder treatment delivery, it will be per user per service, and we are targeting employer based insurance coverage right now, and that would be platform and outcomes based pricing. So we would prove that we were able to reduce hospitalizations and ER visits. And I'm an expert in value based pricing and value based contracts as well. So we would be working that route with the health systems. And our exit strategies, IPO, mergers and acquisitions in the very long term. Our financial projections, these are very conservative financial projections. In year one, we would generate around $6.8 million in revenue. In year two, around $46 million in revenue. And year three, when we go into treatment delivery, we expect to start generating large amounts of revenue, around $192 million. So
Do you
it's a
think
very
the insurance companies are going to mandate once this is up and running? It seems to me like the insurance companies will do almost anything to save in deploying capital as a result of claims, right? So it
yes,
sounds like once you demonstrate that it has a good effect, aside
correct.
from the employer
Yeah,
wanting to do it, the insurance company is going to probably say, okay, if you do this, then we
yes,
can,
yeah.
get some breaks on your premium.
Correct. Absolutely. So that is the reason why we are doing this study, because we want to like go into patient treatment delivery. And it's very important to first establish that credibility with clinicians and with insurance companies. And even with pharmacies, they have their processes where they need to see evidence or improvement in outcomes for them to cover. That is one of the reasons why big companies like Amazon and Apple have not been able to break into the patient market, although they have the technology with their wearables. And even now they have like a blood glucose and blood monitoring device, blood pressure monitoring device approval from FDA, because they are seen as tech companies. So when you're serving patients, you need to generate the data and evidence needed for insurance coverage. And that is the reason we will have our clinical outcome study first. And that is, how we go to the employers, even for enterprise contracts.
Yeah, totally makes sense.
Yep. And this is our R&D platform, and I thought of giving a snapshot to all the investors because this is a very exciting platform for us personally. Because my grandfather was impacted by dementia, and we have a family history, and this is something that's going to be totally breakthrough. Because right now they assess neurodegeneration using paper-based tests and MMSE. And then for Parkinson's, the physicians just look at patients walking to determine their neurodegeneration. They have blood tests to detect Alzheimer's, but what our goal is, we want to make sure that people with mild cognitive impairment who are functional and who are able to take care of themselves and do their finances, they are able to seek treatment or get support um, you know, at the right time before they develop Alzheimer's or dementia, and then help them, be independent and lead a very good quality of life for a longer period of time. And the way we do that is a whole person neurodegeneration assessment. using AI speech detection model, using the mobility model, which is done with spatial body mapping, and clinical biomarkers to understand genetic predisposition for comorbidities, AI for microbleeds detection, and again, integrating the physiological biomarkers like sleep, physical activity, behavior. And once we are able to do complete neurodegeneration assessment, we offer personalized advice to the individual and support them to improve their mental health and improve speech, mobility, and relearn lost information, give them nutritional coaching. And then for advanced care in nursing homes, we would have environmental sensors for object detection. So you can see your loved one on your phone, and if they are about to have a fall, a trigger or an alarm will be set off, and a person or nursing staff will go and check on the person. So this will not only help reduce falls but also reduce nurse staff burden. So right now, what we have been able to do is develop a beta model for mobility. And this was developed by our CTO, Ian Thornell. This is the kind of work that really technical companies like ARM do. And what we are trying to do right now is we have a proposal for a clinical study with 13 patients living with mild cognitive impairment and dementia. And we want to collect data from them on speech, map their walk, do spatial body mapping, have access to their brain scans and clinical biomarkers for developing neural network models to assess complete neurodegeneration. And then we want to conduct focus groups and in-depth interviews with them to understand their contextual experiences while living with dementia and how we could incorporate and improve their standard of living and quality of life. And this would have an FDA pathway with 510(k) approval. And we want to also do this study at Los Angeles General Medical Center. I haven't submitted the clinical protocol yet because we want to get some investor interest and some commitment for funding before we do that. Our go-to-market strategy, as I mentioned, first is employers, benefits, and HR leaders. Then there are the insurers. For the insurers, because we would have an ecosystem for our substance use disorder patients, which would include psychiatrists, therapists, coaches. So the pricing for that is different. And when we benchmarked it against our competitors, it would be around $250 per month. With the entire support system. And then for longevity, we plan to have a separate kind of go-to-market strategy. It would be for hospitals and nursing homes, but also B2C for individuals with mild cognitive impairment, because we see a huge market where people with just mild cognitive impairment will be able to just seek support and live longer. Yeah.
Do you see that B2C largely the children implementing it for the parents?
Um, I think there are two aspects to it. One would be people themselves. Now, this may be an extreme example, but we have seen people in the media like Chris Hemsworth. He's a perfect example. He is very healthy, has been like the lead actor in movies like Thor, and he realized he has predisposition for Alzheimer's and actually very high propensity of developing that. So somebody who is even in their mid 30s and mid 40s, and they realize that they have some mild cognitive impairment, it's a great way for them to just prolong their independence and extend quality of life. Even if they are able to extend their quality of life by 5 years, where they are able to bathe by themselves and drink water by themselves, and watch their grandkids do their graduation walk, that's significant. And I think it's such a huge population with like 55 million dementia patients. So people with mild cognitive impairment, it's an even bigger market. And if you think about from the finance perspective or from the market perspective, there'll be people who will be able to do this out of pocket.
And I imagine there's interventions, right? Once you identify something, that it's not necessarily just extending your quality of life, but
Yeah.
it I imagine that the program will suggest, well, if you do this, it might
Yep.
completely eliminate that or at least help it, right?
Correct, correct.
Yeah.
Um, that is what our goal is, and that is what we expect to see. They would probably have 3 to 5 years extended quality of life, like, where they're at 100%. So that's significant. Um, yeah, and from competitor analyses, for our substance use disorder management platform, our main competitor is Pelago, and they are into disease management like us. So we do not need FDA approval for that. They did their CDC funding round with 54 million raise. And the way we are different from them is that we have really advanced AI capabilities and real-time support for these patients and real-time monitoring. So we will be able to prevent relapses and prevent hospitalizations as opposed to just providing care in an ecosystem. But the market is so underserved because if there are 40 million people and only 2.7 million people seeking treatment, I really also want to thank my competitors for serving this patient population. And they are also doing a great job just with, this 360-degree care model. So they were able to reduce the cost per substance use disorder patient by $9,000 with just the ecosystem.
Wow.
Yeah, so uh, we are our technology and our platform is 10x advanced with real-time support, and we expect prevention of relapses and hospitalizations, not just treatment. And so our cost savings with our platform are going to be significantly higher. But yeah, I mean, we need people to be in this therapeutic area and help these patients.
And back to
Especially,
that list 1 second. The
yeah,
thing that strikes me is arguably one of the most important things that you're doing, not just against Pelago, but the root cause detection, right? So
correct,
that kind of says it all right there, right? Let's find
correct.
out what's wrong. Let's fix that,
Yeah,
right?
yeah, yep.
Yeah.
And some of these patients, or many of these patients, are at the onset of depression, onset of substance use and alcohol misuse. And we want to be able to catch these people at the right time and provide them support, in real time by detecting what is causing this onset of substance use. Maybe it's stress, maybe they're having issues with their family, maybe they have access to those drugs, and they're just using that to cope up with stress. So we will know exactly what are the stresses, or maybe they're not getting enough sleep and physical activity, or they're not socializing enough. So we would know that, and then we would give those intervention to those people, and we incentivize them. So as a behavioral health economist, we have incentives integrated into our platform, where if they go and meet their friend, they collect points and they can go and redeem those points in our marketplace. So it's very, very incentivized. And what we have seen in research is that nudges and positive incentives work better than negative incentives. So if you not just with people, even with children, if you reward them for their good behavior and for taking care of themselves, they do better than just criticizing them.
Carrot rather than the stick, right?
Yeah, yeah, yeah. And yeah, for our enterprise stress management platform, we have few competitors like Thrive Global, Modern Health, Be Well, and each of these companies, they are unicorns right now, because the problem of stress is such a big problem for even employers with lost work productivity, high turnover rate, um, and absenteeism. And Thrive Global, they just use micro goals, and they have a very good platform where they have meditation modules. And then Modern Health, they have support in terms of therapists. So they're literally doing basic things for stress support, and even with that, they are showing decrease in turnover rate, and cost savings for employers. Here we have a platform that's going to completely change the ball game, because we are able to help them detect the root cause of stress, support them in real time, and really help the employers. But I also wanted to share with you right now, our valuation analyses. We did a scorecard method where we compared our company with competitors, and they are between 10 to 15 million dollars in valuation bucket. And so, according to this method, they compare on different aspects like team strength, market potential, product differentiation, traction, and competition. And we, scored better than the competitors in every single bucket. And yeah, and our final valuation came, in between 24 million to 27 million dollars, which is pre-money valuation. And we have just benchmarked ourselves, against just the right competitors, with within mental health space, because there are not many in substance use space. Yeah.
Are the three prior competitors that you showed on that,
Yeah.
those three, are they uh, approved for reimbursement by insurance companies, Medicaid, and all that business?
Yeah, so Thrive Global, it's a productivity software. So it
Ah,
goes through
yes.
HR.
Yeah,
Modern Health, it goes through benefits. So they have coverage.
yeah,
Um, I don't think they have Medicaid coverage, but they do have, employer covered health insurance coverage.
yeah.
And I think Be Well also falls in the same category as both of these two. And I also know their pricing benchmark, So Modern Health, they price their product between like 15 to $21 with the therapist. And we have a platform that's probably 10x advanced with like real-time support, but we want to price in the same range as them,
Yeah.
and we want to make it accessible to employees. But the way we do this is that we won't have certain AI capabilities in the system for employees. For example, they don't need detection of relapses or suicidal ideation, or they don't need these AI agents for patient feedback. So we would have an AI agent for them, but not for patient feedback when they go for their therapy appointment or when they get, medication.
Yeah.
So with that, we were able to like contain the price point. Yeah.
Makes sense.
Yeah. Yeah, and our investment ask is $5 million for 18 months runway for two clinical programs to validate our AI system for substance use disorder management. And the other clinical program is for um, generating data for speech, mobility, and brain scan neural network models in dementia. And that's going to be, 50% of our investment ask. And then we need to hire people, especially for our full stack work and for developing dashboards. And our framework is completed. Most of our build is completed, but we need additional engineers. And then we have AI, engineering capabilities in-house. Very, very good, with our CTO, Ian Thornell, and he has the expertise in building variables and even doing spatial body mapping. So it's like really top-notch NVIDIA and kind of, technical team that we have in-house. And then we have AI advisor and clinical advisors also on our team. I also wanted to mention to investors, we are open to doing a convertible notes round or pricing round. It really depends on our investors and what is their preference. But right now, because we are doing a very small round, we prefer YC saves. Yeah.
Makes sense. Is this uh, I'm glad we got started on this early because you just started the raise and we talked a little bit about
Yeah.
how it's going, and there's at least one, maybe more, because we didn't get a chance to talk about it,
Yeah.
of people who really understand this that are interested in
Yeah.
stepping up. How long have you been at the raise? Not long, right? Just a few weeks.
Yeah. Just a few weeks. This is more of a late seed, pre-series A round for us. And that is because we do have clinical and engineering validation work, right? And then just with my internal, our internal expertise, we were able to develop a clinical protocol and get IRB approval for our clinical study. So we are really waiting for just the raise. And so we started beginning of November, I think, like around like, yeah, 3 to 4 weeks back. And yeah, we have interest from a very, very good VC firm now, and they invest in diagnostics and digital health platforms. And then we filed our patent application during this period. So our patent attorney, he's also an investor in our company, and he's one of the people who is helping us get access into HCA healthcare, which has about 186 hospitals, and also with Stanford Healthcare. So yeah, he'll
And so
be.
far, you've self-funded this more or less, or there have been angels?
I have some investment from family and friends. And yeah, so it's more like bootstrapped at this point. And the amount of work that we have been able to do, if we quantify that, it's about $1.5 million worth of work with our engineering models, validation, with our conference presentations, and with also our clinical study, clinical protocol development, and our IRB approval. Yeah.
What's the next milestone that which we may have already talked about it, but just to be clear with the group, that will uh, cause revenue?
Yep. Um, so with this clinical study, we would start generating results and outcomes in month one, and that should help us get contracts and revenue, help generate revenue starting from like between 3 to 6 months. Yep.
Yeah. Yep. Super interesting.
Thank you.
So is there anything else you'd like to share?
Yes, we have these really two breakthrough platforms that are going to change in entirety the treatment delivery system in the US, and also improve outcomes. And we have one platform that is, very close to revenue generation, and it just needs some help and support for our clinical program to generate clinical outcomes to take to insurers. And then we have the second platform that is more in the R&D phase, that's going to follow the FDA 510(k) approval process. And that is going to help people live longer. So these are really two defining problems right now for health systems and also for families across the US and everywhere around the world. And yeah, we are seeking your help, strategic support, investment support, to bring this to market and help people live better and longer. Yeah.
Yeah, perfect. When does the LA hospital uh, project commence, or has it already started?
So we started it, mid of this year with just uh, clinical protocol development, and the IRB approval process. It takes a couple of months. So now we have a tentative IRB approval already, and so if we are able to close our fundraising this December, we would start recruiting, from beginning of Jan. So we are going to be in recruiting phase now. Yeah.
So if you got $1 million in of the 5 million, you could start.
Immediately. Yeah.
Yeah. Yeah. So I think that's interesting for everybody to know. And it's also helpful to know that you're flexible in terms of terms if somebody wants to do a convertible note and that sort of
Right.
thing. Uh, yeah, I think this is super interesting. It's really the three companies that you showed are somewhat different than what you're doing, but they demonstrate that there's an appetite because they're all unicorns, right?
Correct.
Yeah.
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 Uh, and in terms of technology, like one of them, they just have these micro goals and meditation modules, and the other one, they just have support in terms of mental health therapists. And so they're technologically naive, at least at this time point, and even then they're unicorns. And so the market is showing you that it is underserved, and it's not just the evidence, with research papers saying that, hey, 85% of the people or employees are stressed and it costs US economy $300 billion. But it's showing you in by when you look at these companies, with not that advanced technology is doing so well. So yeah, because there are not many players serving the market. And then if you look at substance use disorder, it's even worse
Yeah.
because of 40 million people, there are only 2.7 million people seeking treatment. And in rural areas, there are no prescribers, very difficult to get to the hospitals. So you need digital health platforms. And our main competitor, I can see, is like one, like, with Pelago. So we need to have a digital healthcare system so that people can access treatment and then also keep them in the system, make them treatment adherent, help them, in real time and support them in real time. Yeah.
We have a couple side questions here, but the the substance abuse business where people go in and try to recover, and then 90% of them relapse, that are those, and I don't mean to be negative, but a lot of those substance abuse in-house resident programs are designed so you come back, right?
Yeah.
I don't mean to accuse people of doing nefarious things, but it seems that to be the case, right? Is is there an opportunity for you to have them as customers if they're really incented to keep people from relapsing?
Um, so right now we are not focused on people who do like in-house behavioral health, like, the reason being, our goal is twofold. First is to help make sure that individuals, healthy individuals who are at the onset, do not advance to like major depression or very advanced substance use problem, and provide them support when they are at the onset, and then keep them adherent. So that's one aspect. And then there are these other people who come back, right, from rehab, and they need support in real time. They need that level of monitoring, where they don't go into relapses because they may not take medications, or they may not attend their therapy sessions. And so I think these are the two groups I would think would benefit most from the digital health platform, along with people who are not able to access treatment at all in rural areas. Yeah.
It totally makes sense. Yeah, I think that I mean, we know what I think the healthcare is 13% of the GDP. Like there's lots of money sloshing around and much of it wasted, I,
Yeah.
I fear. But uh, yeah, this looks like it definitely could help a lot of people, especially against the backdrop of the three that you mentioned and how limited their
Yeah.
execution is. I mean, it's very
Yeah.
limited, right?
Yeah.
Yeah, yeah. I super appreciate you doing this.
Thank you
And
so
it
much.
looks like you've got a good chance of success, and I hope that you do. We'll make sure that everybody in the audience gets your information and connects with you directly. And I super appreciate you really going through all this because while it's complex, it's pretty simple, right? When
Yeah.
you come down to it, it's people need help,
Yeah.
and it's just a more efficient way to delivering the help. So I
Right.
really appreciate what you're doing as well.
Thank you,
So,
Arthur.
yep. And thank you everybody for being here and sharing with us the only thing you can't make more of, and that's your time. And we'll make sure everybody gets in touch. Thank you,
Okay.
Shada. Thank you. Till next time.